We need to ensure that we are focused on delivering results for patients. We need to ensure that we're redesigning services for the long term, not taking short-term measures in order to try and cut costs. But we need to deliver efficiency savings as well as the increase in the budget of the NHS if we're going to meet demands. In truth, of course, what I think they don't recognise is that we're doing those things. We are integrating health and social care effectively. They do acknowledge that. But we are also, this year, showing that we are managing services in the community more effectively, delivering care closer to home, the right care at the right time, at the right place. And that is having the direct effect of minimising demands on hospitals. So GP referrals to hospitals are down so far this year. The number of unplanned admissions to hospital are down so far this year. The number of outpatient attendances are down because we're managing services more effectively. So that is doing precisely the thing they're looking for. The Select Committee report says what it thinks ought not to happen. It refers to suggestions of short-term expedients and salami slicing as though it shouldn't happen. Well, it shouldn't happen. And I actually don't think that across the NHS, generally speaking, that is what's happening at all. I think people are working hard to ensure that they redesign services. Because otherwise, what's the point? What's the point of saving money by limiting patients' access to the services they need in order to invest that money to give patients access to the services they need? The short-term savings would be completely pointless. Why does the Royal College of Nursing say they're in favour of the bill for 12 months? And then suddenly say they're not? The answer is because actually they were unhappy with the government on pay on pensions. They don't think there's anything actually they should or can do about that, but they want to have a go at the government. I'm afraid, you have to expect sometimes that vested interests, particularly in trade unions, behave in a trade union-like way.